I'm Ruben Abati.
And I'm Oji Akbe.
Adolescence and the early years of adulthood is a time in life when many changes occur, from changing schools, leaving home, and starting a university or a new job. For many, these are exciting times, while for some people, they can also be times of stress and apprehension. Imagine growing up in our world today, constantly battling the effects of human rights violations, wars, and violence in the home, schools, and businesses. Suicide and substance abuse numbers have been steadily rising as young people experience bullying. In some cases, if not recognized and managed, these feelings can lead to mental illness. Mental disorders comprise a broad range of problems, from schizophrenia, depression, intellectual disabilities, and disorders due to drug abuse. Most of these disorders can be successfully treated. Today, the World Federation for Mental Health is focusing the 2018 World Mental Health Day campaign on young people and mental health in a changing world. Joining us today to discuss this health-related issue and the stigma associated with it is Dr. Ogonnaya Ndupu, a consultant psychiatrist with Lifecrest Medical Services. Doctor, welcome to the morning show.
Good morning.
Good morning.
Yes.
Welcome to the morning show.
Let's start with the theme of this year's World Mental Health Day.
Yes.
Young people and mental health in a changing world. How much of the demographics at that level in Nigeria would you say is suffering from one form of mental health or the other?
Recent studies now estimate about 10 to 20% of these young people may have a mental illness. There was actually a study that was done 2 years back on suicide, and they reported 12% of adolescents have attempted suicide the year before that study was done. That high.
Young Nigerians?
Yes, young Nigerians. Adolescents, these are people 19 years and below.
Wow, that's a lot.
Yes, 12%. This study was done in this country. Yes.
But what could be responsible for that?
The society is changing, and there's a lot of pressure now, expectations at the school level from family members. While you're in school, there's a lot of expectations to do well. After that, the challenge of unemployment in the society, that has been shown to increase the stress on these young people. In addition to that, there's been a lot of experimentation. We have the increase in drug use. It's all over the place. It's been rising. Now it's not about the male adolescent. You have even females competing with them as much. Then also you have the issues of war. Take, for instance, Middle East. A lot is going on. There's a lot of violence in this country. There's a lot of people displaced as a result of natural disaster. These are things beyond their control. But we know that whatever form of trauma, it could increase your risk for a mental illness. So these young people are not, they are also victims. Poverty, unemployment, violence that is ongoing, all that just adds to the stress and predisposes them to a mental health disorder.
But you know, how do we help these adolescents? Considering the fact that in Nigeria, many parents are also busy and they don't pay attention. And these adolescents may not be able to take a decision on their own. And you know, generally, of course, the decision to seek help is usually involuntary. How can we help, you know, Nigerians, young persons who have this challenge?
I think in Nigeria, we can do a lot more. We need to make this noise a lot louder in schools, community-based interventions. We need to begin to talk about mental health at school level, that people learn not to stigmatize. They're able to open up. I feel this way, I feel that way. It also involves the parents. Parents knowing that, oh, okay, because a lot of reasons from research why people do not present is stigma. And stigma, we know, is the result of lack of awareness. You're not well informed.
Okay, so I want to touch on your lack of awareness. How do we detect people like with genetic mental illness, like schizophrenia or bipolar, things like that? How do we detect that, and how can we prevent, you know, or even go ahead to try to make awareness of it? There are some
most mental health conditions have a genetic vulnerability. Not one factor is responsible for a mental illness. There are multiple factors. It starts with a history of a mental illness in your family.
In your family.
Yes, usually. And then even your personality. Take, for instance, people who have anxiety, who have depression. They have a type of personality. They are the same people who will ruminate excessively over issues. They worry a lot. Personalities like that, you know, this personality is already predisposed to a mental illness. Then you have the factors I talked about. This is beyond genetic makeup now. You have people at risk. Childhood trauma. We have child abuses going on in this country on daily basis, be it sexual, be it emotional, even neglect. That is a childhood trauma that we know over time. Children who are exposed to environments like that, it's like one risk on top of the other.
I want to touch more on the genetic.
On the
genetic. For our parents who are listening. And how can they detect their child? Like you just told me mood swings or what else did you mention?
Having a family history already, you need to have your senses together that if there's someone in the family, in the history, in the lineage, someone that has experienced this in the past, you need to watch out for symptoms in your child. But you need to have in mind that sometimes it skips generations.
That's what I meant. Like, yes. so for people that don't even know that they have it in their family and all of a sudden this child starts to display, what type of symptoms are you?
Depending on the type of mental illness this person may be experiencing. For adolescents, it could start with a change in personality, unusual behavior. I hear people tell me he suddenly keeps to himself, interacts very little. It could even be a decline in academics and functioning. Okay. They appear fine, relating with others, but you notice the school's been going down. Or it could be a dysfunction in his relationship with others. It could be a neglect of his personal hygiene. It could even be not sleeping well at night.
Let's go back to the point about stigma. You know, the official mindset in Nigeria is determined by, first, the Lunacy Act of 1958. In 1991, the Nigerian government tried to come up with a mental health policy document, which says all the right things, but that's just a document.
Yes.
Now, in 2003 or thereabouts, there was a bill before the National Assembly to come up with a proper mental health act, which will be in keeping with WHO standards and respect human rights, because under the Lunacy Act, once you display any symptom of hearing voices or of depression, you are classified a lunatic.
Yes.
And even in terms of how people are treated under that law, and those practices subsist. Don't you think that is what is mainly responsible for the stigma and people not wanting to seek help because they don't want to be branded crazy?
Yes, partly. That's part of the reason why we have high incidence of stigma in this country. In addition to that, we also have this cultural beliefs where people still hold on to the fact that mental illness is as a result of a curse from the gods. A lot of people haven't gotten to the point where they appreciate that mental illness has to do with the brain. There's a chemistry behind it. So a lot of people still feel it's a curse. That's the same reason why they would rather go to churches, they would rather go to spiritual homes, rather than go to mental health facilities or seek professionals to help them. So it's still part of it. And until we are able to review the mental health law in Nigeria, it still keeps us behind. We are backwards, and it's affecting both presentation, affecting even treatment of these people. Because you see them, a lot of people would not comfortably walk into government hospitals because of the fear of stigma. I do not want to be tagged as in having a mental problem or being, you know what they say, being mad, what the layman would say. So if we're able to address that, a lot of people will be a lot more comfortable to seek help and to go to the proper place early. Because what determines the outcome of the mental illness, of the treatment, is how soon do you present. You could have just started having symptoms of poor sleep and they never present. 1, 2 years, 3 years, and the person is now hallucinating, decline in his personal hygiene. It's taking too long for you to present. So for patients like that, the outcome is slower to get him back to his premorbid functioning, and sometimes It's quite challenging, I tell you.
Is it because of this stigma that, you know, many doctors, first you have to be a physician and then you specialize. Is it because of the stigma that we don't have enough psychiatrists in Nigeria? In the WHO AIMS report, done by Professor Gureje and others, we were told we had only 42 psychiatrists,
yes,
20 psychologists. Now, the latest report says we have just about 130 psychiatrists in the entire country, which is a ratio of about 11 to 100,000. Is it because of the stigma that many of your colleagues, doctors, don't want to be psychiatrists? Because I know psychiatrists sometimes, when a psychiatrist does something, they will say, oh, she's been spending too much time with mad baby. She's beginning to behave like one.
Partly from experience,
yes,
we know our colleagues also, to an extent, there's a bit of stigma amongst ourselves as regards mental health.
Then we need more professionals. What can we do about that?
Beyond that issue of stigma, then there's the issue of occupational hazard.
Okay.
Yes. Yeah. The fear of mental illness is being attributed to or synonymous with violence.
How do you deal with violence? How do you deal with your violent mental patient?
It takes experience. You know, you are able to predict a patient's behavior. So most times you need to guide yourself. You need to, there are signs you watch out to that enables you to probably sense this person is likely to be violent. For instance, he walks into my consulting room and he's a bit verbally aggressive. Even when I try to calm him down and he's not listening, he doesn't want to listen to anyone. That's, for me, maybe a sign. And then the previous history of violence, if I probably hear that he's been violent back at home, or he's destroyed things, it's been difficult getting him to the hospital, I know that this is a candidate with a high risk of being violent to staff and to myself, so I need to prepare everyone's mind. You need to protect yourself, even while you're trying to help this person.
Okay, so your focus is on treatment, advocacy, and as well as preventative, right?
Yes.
Correct?
Yes.
How did you get into this field? Just so that maybe people might get inspired by your story.
I just, back in med school, I just, initially I used to be, like the general public, be scared of people who have mental health issues.
You were scared?
Yes,
okay,
that was how it started. And then my school, then you're forced to do some months in this specialty. It's a subspecialty you need to, as medical students, go through. And my exposure to that, you know, more like your exposure to your fear. Over time, I found out that these people, there was no need to be afraid. There were people that were very loving, people that could be helped. And for me, I just found myself being more attracted to them, that because I was able to watch patients being nursed to recovery and then compare what they were before. We've had people being brought from the streets, and 5, 6 months later, you can't believe it's the same woman who was on the streets some months ago. So for me, that's just kept motivating me, knowing that these people can be helped, notwithstanding the stigma.
Well, let me ask you this question. There are many people offering mental health services in Nigeria. There are persons who were psychiatrists, who are the doctors. You have psychologists. You have behavioral therapists. We have people running NGOs. I mean, we've had so many on this program. You have churches. You have herbalists, right? You have sorcerers. You have all now, sorts. Who really should, you know, the Nigerian who needs help go to, or who should families go to? Where can, you know, people get the best form of treatment? Because it's like an all-comers field. Yeah. Everybody is a counselor or a diagnostic expert.
My advice for everyone is, if you observe anyone, or even yourself, maybe having symptoms of a mental illness, which I was hoping to even talk more about, I would advise you go see a psychiatrist or a psychologist. Reasons being that they are able to make a diagnosis. A good number of people do not get the proper diagnosis. Even going to a hospital, you would find that when you get to a hospital, you see a doctor. A lot of depression, for instance, sometimes they do not present with, not in the early stages would you see someone who is depressed come out suicidal. Suicidal is towards the end, you know, when it's very severe usually. But they would present with everyday symptoms. They would tell you, I have body weakness, I'm unable to sleep. And you could easily mistake that for other medical conditions. But the moment you're in a hospital, I'm sure after the doctor sees you the first time, he probably has high suspicion index that, you know, there may be more to this if your blood workup comes out normal. So he's able to refer you to the next level, where that's why I emphasize proper assessments. That's the only place you can get a proper assessment done. If you see a psychiatrist at the time of commencement of the symptoms, or a psychologist is also able to say, you know what, this is psychological, you need to see this. Yes, other places, you see a lot of them, the NGO, the churches, the harbor homes, I think they just gamble with the lives of patients. Yes, that's what they do.
No, if you leave out the churches, then, I mean, how about the argument that ill health, mental ill health is spiritual? That it's something to do with the spirit, that there are certain forces that may be responsible. I even read a book by an expert on depression, and he was saying, yes, you know, mental health is a spiritual thing.
Yes, there's a school of thought, there's an aspect to that. Even for prevention, we tell people that it's important, you must believe there is a God that would help despite what you're going through. But when it comes to treatment, we are not against you having prayers, but there's a place, emphasis is on medical help. Because we know that, like I said earlier, there's a chemistry to this. There's abnormality in neurochemicals. And that's where we know the place for medication is, beyond our psychotherapy, the talk therapy. So as long as there's science to back up that before people get depressed, or when they do get depressed, you have the serotonins reduced and all those chemicals in the brain a bit below or above what they should be. That's why drugs help. Okay. So we are not saying don't do your prayers, don't get your spiritual help, but that you must also seek medical help. And then, because these people are skilled to make a diagnosis and say this is the type you have. Making the proper diagnosis helps us to make, you know, the most appropriate medications to use, rather than you try this, you try that.
Okay, so you wanted to talk more on the symptoms. Is that what you said?
Yes,
okay,
on
so
the
can
symptoms.
you tell us more
General
on the
symptoms of mental illness. It could start, like I mentioned earlier, sleep issues, even eating. Sometimes for depression, you could have the individual not having adequate sleep, having challenges falling asleep, or even staying asleep. In a rare type of depression, you have them sleeping excessively. There may also be a change in their eating habits. You find out that you're not eating well as you used to. There may be weight loss. You may also notice that there's loss of energy. You have no interest in things around you. You're probably someone who likes to hang out with people and have fun. You're no longer interested in all that. For some, it may be you notice there's a change in your thinking pattern. We call that, for some people, you could have what we call paranoid ideas or delusions, where you begin to think for no good or adequate reasons, you feel people are after you.
Is that some kind of schizophrenia,
yes,
correct?
Yes, yeah. I was about to say, yes, that's what you see in schizophrenia, or in very severe cases of depression. Then you could also have hallucinatory experiences, where you sit and in clear consciousness, you hear people.
You're hearing voices.
You hear voices. It could be in different modalities. Hearing voices, or even tasting your mouth, an unusual smell. You're somewhere and you smell something weird, something funny, you know. Or it could even be on the skin. That's a form of hallucination, where you feel tingling, peppery sensations, which is what we see commonly at the primary health care. Early signs of depression, somatic symptoms for some people, and they just tell you peppery sensations all over, there's hotness in my head, hotness in my limbs. Sometimes it may be suggestive of that. And then people report that other symptoms of a mental illness, people report that you are not relating with people as you normally would, decline at work. Some people just begin to lose motivation, not interested in going to work. And then for some people, aggression, verbal, physical, but the percentage of people who have verbal and physical aggression, they are very minute. Majority of people who have mental health illnesses are the people who have the anxieties, the depression. So they're everyday people. They're people who come to work, but they just notice anxiety, for instance.
In terms of treatment,
palpitations and
in terms of treatment, you've talked about, you know, the psychiatrists who can do proper diagnosis, but some general physicians, in part because people don't know where to go to for psychiatry. Yes, Arrow is popular, Yaba Left is popular, but generally we have just about 5 or 6 mental health hospitals. So most people will go to the general hospitals, right?
Yep.
And some physicians who are not psychiatrists, they give out antidepressants, they give out other drugs to treat depression. Is it within their specialization to do so? Because, as I said, almost everybody is a psychiatrist.
It is. It is within...
And there are no restrictions for these types of drugs that they give out, right? There's nothing...
No, they are prescription drugs. But can an ordinary physician take up the job?
Yes, that's what our focus has been, that we need to do more as regards mental. You don't need to wait till you go to Arrow or this. At primary health care level, we should be able to train the staff there that they're able to recognize this. When this person presents persistently with these complaints, you may need to assess. Basic assessments. So even at primary health care, you are putting the staff through what they need to know. Doctors, remember how I told you how I started my practice in mental health? We already have baseline. We have a good knowledge of mental health, every doctor. So they are equipped, and then doctors know at what level I need to then send to a specialist to manage. Basic levels, they can handle that, but when they find that it's getting complicated or the patient is not improving as they would expect, they would always invite a specialist to take over management at that point.
Well, thank you very much, Dr. Ndupu, for this very enlightening conversation on the occasion of the 2018 World Mental Health Day. Thank you very much for coming to the morning show.
Thank you for joining us. Thank you. It's time now for a short break on the morning show. When we return, Arise News analyst Emmanuel Ifeni will join us to review some of the newspapers. Stay with us.